But Eddie and I both represent Dallas, Texas, and we work together a lot. So neither Eddie nor myself are looking to diminish our relationship with each other, and your ability to make sure that we stay focused on that is good. But I will speak for Eddie and myself. We have a great relationship. But we work together on the benefit of people.
Notice we left some space between the chairs. Go ahead, Pete.
Let me say this. I don't know exactly what Senator Kent Conrad is proposing. And one of the reasons why is because this whole plan, now that the American public is debating this and understanding it, members have come home, it's changing every day. If you'd like to describe what Kent Conrad has for these co-ops, I could be open to understanding that. But let me say this. We don't need to go create anything new. We need to work with the existing marketplace that we have and give everybody the opportunity to get the same tax advantages, to be a part of a health care plan, to get insurance. And I could think of nothing better than more people first coming to get an insurance plan, working with their physician that they know on a day-to-day basis of their own choice, and an opportunity not to have the federal government go broke or lose 4.7 million jobs to get there. He wants to, and I don't know what he's after, but I've heard, forming these co-ops that simply still keep the disadvantage for individuals in the marketplace, subsidized by the federal government. I think that's a bad idea. I think we all need to have skin in the game. We all need to understand why we would have insurance. We would respect that and take care of our bodies, up to and including not only what we eat, how we exercise, how we teach our children, our own branding or activities, what we do on a Friday or Saturday night. I think we do have to have that, because the lack of personal responsibility means that people on drugs, gun battles that ensue, knifings, Friday night problems, it is very expensive. And when someone is paying for their health care, they will treat it differently. Said another way, if you don't have any skin in the game, if you don't even have a copay that we've heard about today, your responsibility is virtually nil, except calling 911, having them come pick you up, having them take you to the hospital, and having Uncle Sam take care of you. That's not the America I grew up in.
Congresswoman Johnson.
I don't even know how to respond. I'm certain that there will always be some unexpected happenings that will be real emergencies, not just weekend, but anytime. I mean, I think ambulances work every day. Yeah. But what we're talking about are the various things of which we do have some control over and can offer some direction that would get people headed in the right direction for care. Now, if the insurance companies would cover everyone at a reasonable cost, we wouldn't even have a problem. But these millions of people that can't get insurance in Texas, even if they're working, have to have some outlet to get it. And the outlet does not exist right now. And that is the only reason why we're trying to look at some options. The insurance companies all charge about the same. There's no competition. They don't want any. They've been fighting this change for 30 years. And it's time for the change to come. Because what we're doing, everybody who has insurance are paying for all these people that are having to get sick care and not having a way to help pay for it. This is the main reason we are looking at it one more time. If you recall, when Social Security came into being, it was soon recognized later that not only did they need a little bit to live on, they had to have some kind of health care. And Medicare came up. It took 20 years to pass it. And that is the reason, and the only reason it passed then is because Lyndon Johnson won as president and took in an overwhelming number of Democrats. When it was passed, he flew to Missouri after President Truman retired to get him to sign it because he'd worked for it all those years. Anything that's for people is hard to come by because the money-making people do not want to share anything. That's the only industry of insurance that hadn't been affected by any kind of recession, anything else, because they are making lots of money. The Medicare Advantage, which is about to put Medicare out of business, made $119 billion more than Medicare paid for the other ones. It is something wrong with that picture, and it needs to be changed.
We just have time for a couple of more questions, so please do.